Hey, Dr. Mindy here on your fast training week, and I want to just start off by acknowledging all of you guys that have been on fast training with us this week here on YouTube. We've had great comments on the videos I've posted and on my community page. So I'm so excited to be doing this with you every month, where we're bringing a fast training week experience here to YouTube, and then we're bringing it here also to Facebook. So you're getting on both platforms, okay? So let me just start. And if you're, oh, by the way, if you're not familiar with Fast Training Week, I do this once a month, 5 days out of the month, where I coach you through the different types of fasts. So if you're watching this at another time, or this is a new concept to you, if you subscribe and you hit the notification button, you will be notified when the next Fast Training Week is. You will see on our community page when it comes around. So today, what I want to talk about to you guys is how long should you fast? So this came up in my Resetter group on Facebook. It's come up here on YouTube before. One of our most popular videos here on YouTube was one where I showed a chart of how different things are happening in your body the longer you go in a fast. So I'm actually going to update that chart because it only went to about 36 hours, and I'm going to take it all the way to 72. So if you want a copy of that chart, it's called an Autophagy chart, just put that in the comments and we'll make sure you get it. But let me kind of start off by walking you through your body and talking to you about what's happening the moment you eat your last meal. So actually, I'm going to take it that back. I'm going to go one step before that. When you eat a meal, you guys all know here on this channel that you're going to get an insulin spike. And we want to keep our meals low in carbohydrates, moderate in protein, so that insulin spike is minimal. Once you finish putting that last piece of food in your mouth, now what's going to happen is that your insulin's going to go up, but then it's going to start to dip and it's going to start to go down. So research, this is from Dr. Fung, is showing that from hour 1 to hour 12 is typically when that insulin is starting to plummet. So it'll spike and then it'll start to go down. So this is why the 6 meal a day never really worked for us, or eating breakfast as the most important meal of the day, is because if you ate dinner at 9 o'clock at night, you got up and had breakfast at 5 or 6, you never got past that 12-hour mark. Your insulin was just recovering from dinner, and then you started back up with breakfast. So in the fasting world, we want you to go well beyond 12 hours. So Dr. Osumi taught us that between 13 to 15 hours is where the cells will start to figure out where it needs to go to start to find food. Your body will start to signal. There's a signaling process. We call it autophagy. And there's a signaling process where the body goes, hey, there's no more food coming in, so I better go look within and eat the toxins that are inside the cell. So that is the term autophagy, and where autophagy started was with the research that Dr. Osumi did on cells. And by the way, next week I will be interviewing Naomi Whittle on this. She actually had a personal interview with Dr. Osumi, so we're going to talk about what she learned in that research. So stay tuned. That will be on Resetter TV. So, but he really brought to our attention that the longer you go without food, the body has to go find it somewhere. So it will turn within, and that is what autophagy does. Now, Dr. Fung brought to our attention that the longer you go from that initial hour of insulin spike, the longer you go, as insulin keeps coming down, that when insulin gets to a low point, the body will go find insulin, glucose that it stored years ago in your fat, and it'll burn that for energy. So you're at about anytime after 12 hours, your body is going to find that insulin that it stored, find the extra glucose that it stored. Even autophagy happens a lot in the fat cells because that's where your body stores toxins, is in fat. So both of those mechanisms are beginning to happen. I should say they're warming up around this 13 to 15 hour mark, okay? So intermittent fasting, those of you that intermittent fast, this is a wonderful fast. Beginner fast, it's a good maintenance fast. I don't believe intermittent fasting is going to get you that really deep weight loss result that you're looking for and that really deep detox result you're looking for. It's just a good maintenance type of fasting. So, which brings me, what happens after 15 hours? Well, research says that autophagy is going from about hour 16, 17, all the way to about 72 hours. So in that range is when you are getting maximum autophagy. Now, I want to point out to you that we do not have autophagy strips. We don't have a meter that measures autophagy. So we are making educated guesses here on that autophagy window. But one of the questions that came up in my resetters this morning was, how do I know when I'm getting to my maximum autophagy? And I would say if you're somewhere between 17 hours and 72 hours, you're in a good, that's where you're riding this detox process that's happening in your body, okay? So 13 to 15 hours, your body's going to start to go searching for insulin. It's going to initiate the autophagy process. 17 to 72 hours, now you're in full-fledged autophagy. Your body is searching for insulin and glucose, so it's going to keep on burning fat. So those of you that want to lose more weight, yeah, you want to stay in these longer fasts because you force the body to go find something that you stored a long time ago, okay? Now let's talk about stem cells. So if you go back and you watch the video I did on diet variation, and so many of you gave us positive comments on it, thank you. I did that so that I could clarify this for you. Stem cells are cells that can repair. So cells that we have a lot when we're little, and we have very little as we age. And so stem cells will go into the body and they will identify that there is a cellular repair process that needs to happen. So the stem cell production starts at 24 hours. So this was an MIT study done that at the 24-hour mark, intestinal stem cells get rejuvenated and then they'll go in and repair other cells inside the intestines. So those of you with digestive issues, you want to be doing a lot of 24-hour fasts. You want to have a lot of fasts where you're putting in at least 24 hours. But those of you that are looking for musculoskeletal stem cells, you're looking for immune system stem cells, you're going to have to go a little longer with your fast. So Walter Longo's study done on cancer patients who were going through chemotherapy, that study was done and he saw that that white blood cells, old white blood cells would die off and new ones would be formed somewhere between 2 to 4 days. So we always say 3 days, we kind of put it in the middle, but at about, 24 hours, you're getting the intestinal stem cells. I would say at 48 hours, that process of immune stem cells is starting. It's starting, it's not max. I believe that it's max around 3 days. This is why a lot of people go 4 and 5 because they want, once they get the process going with the stem cells being regenerated, why not stay in there? The hardest part of a fast usually is the first couple of days. So why not go a little bit longer and maximize your stem cell regeneration, okay? So let me recap that just so you're really clear. The benefits of fasting start around 13 to 15 hours. And that's when your body's going to start to go searching for insulin and glucose that it stored a long time ago. By the way, I forgot to mention this, you also get some growth hormone that gets produced at 13 to 15 hours, which will help you burn fat. So this is why intermittent fasting does work. But then if you want autophagy, you really need to go beyond 15 hours. 16, 17 hours is when you're really ramping up your autophagy, and that will continue all the way to 72 hours. You will get that autophagy effect. Now at 24 hours, you're going to get intestinal stem cells that are going to start forming, and if you hang in there and you keep going 3-4 days, with your water fast, now you're going to end up getting a reboot of your immune system. So you really just, I go back to what I said in the variation. What do you want to do? What are you trying to achieve? And so for some of you, you are just trying to maybe not store as much insulin. You just want a light fast. That's where intermittent fasting comes in. Some of you have digestive problems. I really recommend you do a lot of regular 24-hour fasts. And some of you know that you need to reboot your immune system. We are, my husband and I are on our second 3-day water fast of the year. I do it for maximum stem cells, and I do it for rebooting of the immune system. On a weekly basis, I do 24-hour fasts. So you can accomplish both things through your fasting variation, which is why I did the video for you guys on that. Go back, that was a week ago. It was all on varying keto and fasting, okay? So let me know. I hope that clarifies the fasting window. I love the research, so I'm diving in to try to understand a little bit more on what else is happening. We don't have a ton of studies, but we grab onto the ones that we do. Tomorrow I'll be putting a video out here on YouTube on the safety of one of the biggest studies ever done on fasting. Was done on 1,400 people, and it talks about the safety of fasting, adverse reactions, what we're seeing in people's health the longer they fast. And this study was done on people who fasted anywhere from 4 days all the way up to 21. The average was about 10 days. So that video will come out tomorrow. Just hit subscribe and notifications, and you'll be notified when that video comes out. Okay. I hope that explains it. So I want to go through some questions that my resetters had, and some of you guys here on YouTube. You can, if you ever have a question during fast training week, just go to our community page and you can ask it in one of the posts that we make. Every Thursday I go live here, even in fast training week, so you can always ask questions and join me there on Thursdays. Okay, but this is a couple of things that I actually, some of the stuff in my resetters, I mean, what I love about the people that have been doing this so often with me is that you guys are just getting better and better and better at this, and each fast training week is getting easier and easier. This is why I show up once a month full on for you, so that you guys can start to exercise your fasting muscle. So a couple of things takeaways that I had. Christina Carlin in my resetter group posted, and I wanted to point this out, that she is an hour away from 100 hours. So she was almost at 100 hours and her hunger had gone. So the reason that I talk about that is what you're going to notice in these longer fasts is that you're going to have a lot of waxing and waning of hunger. Go watch the video I did on mindset yesterday with Andrea, the interview I did. But there's going to be some waxing and waning, and if you can stick in there, your body's going to figure it out. So I loved that. Another one of our resetters, Deborah Hudson, did our Ketabo shake, or it's not our shake, it's the one we recommend from Revelation Health, and she has been doing that all week, and it's meant to be like a fast mimicking experience. Her blood sugar was in the 70s and her ketones at 2.1, and she was doing after 64 hours of fasting, and that's from doing the Ketabo shake. So that's awesome. And a lot of people going to new heights with their fasting. One of my favorite is Cindy Hartley. If you're watching, she was like an Energizer bunny. She kept cleaning the house, and she was listening to more. She would listen to my video that I did, my interview with Zach Bush. So if you had more energy from these longer fasts, the typical process is in the beginning. You don't feel more energy. I mean, for me today, like around 3 o'clock, this is my second day. I was just a little low. I now have a lot more energy than I did earlier in the day. So once your body figures it out, it starts to make ketones, your energy comes back. Debbie Hobel, who was in our women's reset and I think she's starting to go for longer fast. Debbie, I know you're here on YouTube, so I don't know why I thought I read somewhere you were going to go for a 21-day fast. She loved that the mindset video. So just understanding what to do when you get stuck mentally. Fasting is a mental game. It's a mental game, and the more you learn tricks to help with the mind, the easier it gets. That's why I interviewed Andrea yesterday and put that video on Mindset out there, so you have those mental tricks so you can, I don't want to say breeze through fasting, but you can have some tools that will help. Okay, and then there were two that were really interesting to me. One was somebody asked, is it normal to not be sleeping well when you fast? And yeah, I mean, that's one of the things you'll see on the video I post tomorrow on the 1,400 people, that, yeah, that it's sleep. Like I know for me, I have an Oura ring. So I like to watch my sleep and my heart rate variability during these times. And I definitely go into a deeper sleep. I stay asleep longer. I don't wake up in the middle of the night. And my heart rate variability, which is the measurement of how adaptable your nervous system is, just goes through the roof. And that's a really positive thing. You want a high heart rate ability. So very common to not sleep well. It's common to sleep well in the beginning, and then the longer you fast, your body just needs less sleep. That's what I've noticed. And then somebody asked about diarrhea at hour 48. Remember, intestinal stem cells. So if you were at hour 48 and you've been now secreting intestinal stem cells for over 24 hours. So yeah, your body is sloughing off old bacteria. That's awesome. This is why we do fasting, is that there's no supplement on the planet, there's no doctor on the planet, and there's no medication on the planet that's as wise as your own intelligence. And what we're finding is that the longer we fast, as we practice these fasting techniques, we get to tap into that intelligence. And the cool part is you just get to sit back and watch what the intelligence does. So to me, diarrhea during a fast is not a bad thing, because the body is killing off some kind of bacteria and it's trying to get that out of you. So we have such aversion to these symptoms that we perceive as negative. But something like a fever is a way that for your body to burn out an infection. So there are things that our body does that's a healing process, and we've been conditioned to always want to see them go away. So fasting is a good time to sit back. Pain during fasting, really common. It's a healing process. So great questions. Okay, I will open it up for anybody watching live if you guys have any questions. And if you're not watching live and you have questions, put it in there. My team will go in later and make sure that your questions get answered.
Okay, yeah, we do have some questions.
Okay.
Lots of people want the chart, so we'll be getting that.
Yeah.
We'll be getting a link to that probably within 24 hours to everybody.
Yeah, it might be like the end of the week, because I'm still down the rabbit hole of research with a few things, so sit tight, and I really want to put as much information in there as I can. So sit tight.
Okay, great. So this person has a question about fasting being good for women who've gone through menopause and osteoporosis.
Yeah, so I've done a lot of videos on women and fasting, and what I would say is that if you're post-menopause, you actually can fast the easiest. Like, you don't have to think about a cycle that you need to work around. If you still have a cycle, I really don't recommend these longer fasts right before your cycle. So that's the first thing that I would tell you. As far as osteoporosis, we get this question a lot, which is, will fasting heal X? Like, can fasting heal a certain condition? And again, I go back to the intelligence of the body. I don't know. I haven't seen the research on osteoporosis in fasting. It's not going to hurt your osteoporosis. Will your body actually heal more efficiently the weakening of those bones during fasting? I don't think we have any studies on that. We have testimonials. We have people who have experienced that. We see it in our resetter group. So there is that possibility. Now, I will just two more things on osteoporosis that I want to point out. Osteoporosis can be a heavy metal issue. Lead specifically lives in the bones, and it binds to calcium and phosphorus, and it can weaken the bones. So making sure that you've checked your heavy metal leads, and things like vibration plates. We do this in my clinic, where we have people stand on a vibration plate, and it helps to force more calcium, the calcium that you're eating in your body, to force it into your bones. So those are a couple other good tricks.
Okay. This is from Debbie Hartwell. When you're fasting, do you need to worry about electrolytes?
Yes. Okay. Yes, absolutely. you'll see this in my study tomorrow or the video I'm doing tomorrow. 1,400 people studied, and one of the things that came across was that the majority of them, a good portion of them, were low in calcium and it was zinc, and it was potassium. That was it. And so, but they didn't go low in magnesium. So their electrolyte balance did go off. So yes, electrolytes, the longer you go, very, very important. Sea salt, minerals, any kind of electrolyte, very important.
Great.
Yep.
This person, Lorna, wants to know, can you chew sugarless gum?
Lorna wants to know if you can chew sugarless gum. Here's the way the scientific way I would do it is I would test it. So I would get your blood sugar, I would chew the gum, and a half an hour later I would test it. And if your blood sugar goes up at all, no, it's pulling you out of a fasted state. Usually we say if something goes up about 15 points in blood sugar, it's definitely pulling you out of a fasted state. So I would do the blood sugar test. Now, the second piece of this is that sugarless gum has chemicals in it. So we're trying to detoxify when you're fasting. So it is a little balance. And then the other thing is that we're trying to tap into this internal wisdom of your body. So the more that you put in from the outside in, the more you're going to get a less of a result. It'll be a more muted response.
Okay. This person, Alfredo, has a question about a 13-year-old boy fasting.
Yeah.
You want to talk about kids and psychology?
Yeah, so Alfredo asked about a 13-year-old boy fasting. My first question is he asking to fast? Because if he's asking to fast, then you can kind of watch him closely. But I would never tell a kid to fast just because I was doing it. So I always tell people model fasting and watch what your kids do. So like in our household, we never forced our kids to eat breakfast. If they want to eat breakfast, great. If they don't, fine. So especially the older they get. So as far as if it's all him, I would teach him to watch his blood sugar so he knows when to pull himself out of the fast. And I would make sure that it's all him. And the same rules I'm teaching you, about sea salt and all of that, I would teach him that as well. I mean, if he's going to do a longer fast, he should also know all the rules around it. I wouldn't just throw him into a longer fast without a blood meter and without understanding when to stop that fast. So.
Okay. I think we have time for maybe 2 or 3 more questions.
Okay.
Okay. This is looks like it's Brittany.
Okay.
She's having a hard time getting past 4 days.
4 days.
Yeah.
Okay, so Brittany asked about not getting past 4 days. This is a really good point, whether it's 4 days or 24 hours. How do you help get past a fast? Like, how do you break through that moment that you're just struggling? So first thing I would say is make sure you know your numbers. So if your blood sugar's down in the 30s or the 40s and your ketones are up at 7 or 8 and you're trying to push through to another day, that's not being responsible. That I would say definitely don't do that. If your numbers are good, then there are some things you can do. So one of the things I like is fast tonic. Fast tonic is hydrogen water. So you basically are putting like a hydrogen tablet inside or a tablet on water. It pulls out the hydrogen. Hydrogen will go into the cells and help with the process of detoxification, and they'll power up your mitochondria. It can make you feel better. A lot of people in my clinic, in our resetter group, have said fast tonic has been amazing when they're in a longer fast. So try that. The other thing you can try, and I encourage you to try this with just in moderation, is you could try at that 4th day exogenous ketones. So exogenous ketones, getting ketones from the outside in, sometimes can help push you over that point in which your body's like struggling to do this on its own, and it needs a little external support. So I would do those 2 things. I've also done with patients before where I will have them just do a scoop of nut butter or a scoop of ghee, and then that little thing just keeps them going another couple of days. So those are some tricks that I think will work for you.
Okay. So Carla, who's a Reset Academy member, was over here on Facebook.
Hello, Carla.
She wants to know if she's not fat adapted, would she be losing muscle mass? class when she's fasting. I think she's new in the academy.
So Carla, welcome to the academy, and we have a call on Thursday, so we can chat even more about this. But what I would say is that all of the research out there, and I sat in an hour-long lecture with Dominic D'Agostino, who has done the most amount of research on ketosis and fasting. And it all points to the fact that you do not lose muscle when you fast. You are not losing muscle. Your body is not breaking down. Now, think about it for a second. If the body is struggling because blood sugar is low and it needs to go find sugar somewhere, it's not going to break down muscle to find that sugar because we're primitive. It needs that muscle so that you can go find food. That's how you were primitively designed. So you're not breaking down muscle. But becoming fat adapted, the more you do this, the more your body will go to the fat. It'll go to the liver, which is one of your major fat burning organs, and it will release stored sugar there before it's going to go to muscle. Okay, so the question then is, well, why do my clothes fit differently? I noticed today my rings were different. That's water weight. You're losing water weight, and once you go back to eating, that will come back. That water weight will likely come back. So I hope that helps. And again, Carla, you can join in on Thursday, and we can really dial into this more.
Okay. Lori has a question. Is it normal for ketones to go from 4.3 yesterday to 3.6 today?
Yes. These are great questions. Thank you, guys. Okay. Lori wants to know, is it normal for your ketones to be at 4.3 and then you go down to 3.6? So the longer you do this, the more efficient your body gets at using ketones. The minute the liver produces ketones, the body goes, whoop, I know what this is, and it gobbles it up and puts it up into the brain. That is kind of a part of the fat adapted process. So I don't know how long you've been fasting, but it's possible that you were pushing your body right to that edge of moving into a deeper state. And when it started to spit out more ketones, your body started to use more, especially for the brain. Now, where we see this the most is in the morning. So many people go to bed with these high ketone numbers, and they could get up in the morning and they are in a much lower ketone state, and they're bummed out. But your brain had to survive at night. It's on a 3 or 4 days of water only. It's going to use every little ketone that your liver produced to stay alive in the brain. So very common for it to drop like that. I've noticed after workouts that my ketones will drop. I've noticed after, I did 1 year for my patient base, I did a big live event on anti-aging, and I went into it after on a 5-day water fast, and my ketones were was at 5.0 going into the fast, or going into the speech. I did the speech, I came out there at 3.0 because my brain needed all the ketones I was processing to give the speech. So not a bad sign, it's an efficient sign. So great question.
I think that was pretty. We have more questions, but I know we have to get going. We're almost at 30. You have anything to wrap up? Keep putting your questions in here. I will be back this week live again on Thursday. I'm shooting to come around 3 o'clock is when I do my 3 o'clock Pacific time. When I do my lives on Thursday. So you can bring questions there. If you ask questions in the community section, that's what we did is we put a post in the community section, and anybody that asked a question, I make sure that I get to those questions. So that's how you can always make sure your question gets answered. But I also have an awesome team that's in there making sure that you're getting the support you need. But I love doing this on YouTube. You guys here have been incredible. I love your feedback on my videos. This is how I know what to create and what to give you. So, and I adore Fast Training Week. It is so fun, and the miracles are incredible. So if you're watching this after it's live, please, if you have had an incredible fasting experience, let us know. We literally can change the world with fasting, and we can do it when we rally together like a community. So, as always, I hope that helps.